know, a durable medical device is, first of all, is any equipment that you may need to improve your mobility and for you to be active, right? The paper I handed out are some of the most common ones. Say you can't breathe. You walk for a certain period of time and you start getting short of breath. And they check your oxygen level and realize you may have COPD and your oxygen goes down to 86 or 80. And they say, hey, you're gonna need oxygen, you know? Maybe not in the daytime, but especially when you're sleeping. That is called a durable medical device. CPAP, you snore at night. Snore really loud and bad. You know, move all the family out the house. Because it's so bad. And you need to sleep with a mask that helps to open your airway called the CPAP. Okay? They're getting better. They're getting cuter. They're getting smaller.
Have, if you ever been on a CPAP machine?
Yes.
Does that mean it's a lifetime machine that you need? Because years ago I was on one, but I'm not on it anymore. But a lot of people are
Yeah. She answered. Our guest said that if you have to be on a CPAP machine, which is a machine to help allow oxygen into your body at night, because what happens when people sleep, their head goes backwards or they're laying prone and the airway is closed. And there are many reasons why that happens. The number one reason, remember I told you the first place you gain weight is in your tongue. You guys forgot that? The tongue, not tummy. The back of your throat is, your tongue is a muscle, and then it starts to swell, and then your neck swells. You can always tell when somebody gain weight, because they start talking kind of different, you know? Okay, voice change. So you're getting compression, you have this mass, a lot of weight around your neck. Come on, when you start losing weight, but tell me I can't see a collarbone. You spend to weight, no, right? You start seeing, that's place you're gonna see weight loss. and you'll see the collarbones. But weight gain shows up right here too. Back of the neck, throat, all that starts to compress. Say this is where air is supposed to go through. You start compressing that canal. And then you gain weight in the tummy, as we were talking about. And when you lay down, what happens to the tummy? It goes up into your chest.
Suffocate yourself.
So now, this poor little throat got all this around it.
Oh, wow.
And then it's got this belly showing up here. And the airway is not opening nice and big like it's supposed to. And you can't breathe. At least you don't really notice. Most people don't even notice. It's people around them notice, because they all of a sudden you'll go and stop breathing. And that's scary. You're waking up and you're tired and you feel like you haven't slept all night. You're falling asleep at the wheel or at work because you didn't get enough sleep the night before. And you don't even know you didn't get enough sleep. But you're not getting oxygen. Oxygen is necessary for your brain, right? So they give you a CPAP machine, and what that does is forces the air down your throat while you're sleeping. She's like a dog. And that helps you feel a lot better, because now you're getting enough oxygen throughout the night. So what can you do to help that? One, lose the weight. Get the tummy off your chest. If you have weight that's also showing up in your neck area, again, lose the weight, right? And of course, I can help you with that, with Weight Loss for Life, my program that helps with weight loss. Another thing too is raise the head of your bed. So that when you're laying flat, I said the tummy goes up to here, raise it up a little bit, just some pillows, and bring it back down. And if you can afford it, get one of those beds that can put your head up and you can sleep up. And that will help to bring the tummy down, bring everything down. Yes.
Can one of those beds be a DME?
Aha. Can you get one of those beds that raise you up and down? Depende. You're able to, they call hospital beds, right? If you have sores on your body, especially bed sores, unable to position yourself and get out of the bed. So usually a hospital bed, one that raises up, are really for people who cannot ambulate, people cannot turn themselves, cannot get up. So yes, it's covered, but you have to qualify. In fact, all DME, and that's what you have to know. To get a durable medical, you have to qualify for it. You can purchase yourself. Cash is king. You can always buy any of these things over the counter at the pharmacy or online. But if you want your insurance, which is Part B Medicare, to pay for it, you have to fill a criteria. Okay? So you need to make sure, if you do need it, ask your primary care doctor for it. And they will fill out a form and send it to your insurance company, and they will cover it if you qualify. Here's what I have found as a PCP trying to get DMEs for patients. Documentation, documentation, documentation. Mrs. Jones has fallen 3 times because she has osteoarthritis of both knees and is unstable and needs a cane with 4 prongs to stabilize her. And they were like, again, they will reject it if I don't put those documentation in it. I need a bedside commode. Why? Mrs. Jones has urinary incontinence. She's unstable at night. She's on a whole lot of medication, unable to make it to the bathroom because she doesn't have an assistant who can take her there. So it's medically necessary that she has a bedside commode. You know, they get all up in your business, let me tell you. But the qualifications is really essential. The other thing, certain things require weight documentation. So you say you need a wheelchair, right? You're going shopping, not any of you here, but say you do need a wheelchair. You had hip surgery. Well, they're gonna just give you any old wheelchair unless you are specific. So I have patients who give me the lot number, they give me the manufacturer number, exactly which ones they want. Does it legs move? Does the seat go back? Does it have a seat cushion to it, right?
Can you adjust it?
Is it adjustable? Is it for extra large, extra large, or just a regular? Is it regular weight or is it lightweight? And don't be asking for a lightweight and you over 300 pounds. It will fall apart, I'm telling you. You're not going to get the one that crunchy folds up and throw in your car quickly, you know, over 300. It's not possible. But you can get a folding one and make sure it fits you. Here's what I'm going to tell you about those DMEs though. You don't own them, so you can't be giving people your stuff, okay? Your auntie who just had surgery, here auntie, I got a little wheelchair that no. You're renting these things. You're renting them because if you look on the paper, they ask the question, how long?
Oh.
And I have to say either 1 month, 2 months, a year, or a lifetime. Okay? It's rented by your insurance company for you for that moment. Okay? Even though you've been spitting up in the, you know, in the platoon and all that, and you know they're not going to give it back to nobody, it's still considered a rental item. Why do I say that? First, make sure it works when you get it. I know that says a lot, but I have some patients who call me back and say, Dr. Paul, I need to get me another wheelchair because the legs won't move. Well, you've had it for 3 weeks. You know, you have to immediately evaluate when they bring it, you sit in it, you test it out. If the cane wobbles, immediately give it back. Because it's very difficult to do an exchange because they expect you to keep it a minimum of 3 years before you can get another one. Wow. So don't think you had a wheelchair last year and you're getting a new one this year.
That's probably why they.
Yes.
What happened when the patient passed away? And
There's a phone number usually stuck to those items. You call them and say, please come pick up this chair, the person is no longer here.
Otherwise,
Yes.
what? Person keep getting billed for it?
Oh, well, the insurance is billed. Yes.
I see
Oh,
trapeze on here. Why would someone need a trapeze?
A trapeze, a trapeze is an item that's usually installed above the bed that allows you to lift
Oh,
yourself
okay.
up to
Okay.
get out of the bed.
Okay. I was
Because you
wondering. I
have
thought it
problems
was
getting up.
trapeze.
Yeah. Okay.
And the rail also?
And the
is
railing,
correct?
you have to ask for bed with railing. Again, specificity is really essential when it comes to durables. So the point is, one, if you need a durable medical device, what I mean by that, you've decided that your furniture is going to be your aid. You're doing this all over your house. Holding on to this, holding on to that, stop. You're cruising for a bruising. Get yourself a walking cane, okay? You find that, when you go shopping for long periods of time, you're getting short of breath. Get evaluated, see if you need a little portable oxygen, okay? But pay attention to what your body is saying. There is no shame in having the durable medical devices that you need. If you need a bedside commode in the nighttime, get one. If you need a walker, don't be embarrassed, because a fall is worse than walking around with a walker. And I love the new ones. My last point. There's some really good ones. Ask your providers to get you the walkers that allow you to stand up. We have more orthopedic problems because people are doing this on the walkers. So now the spine that's already curving is having more problems. They have the new ones now. I don't know why they didn't think of it before. Where you can stand erect and the arms are here.
That should have been the first one.
That should have been the first one, but I guess as people get over, you start making better designs. Yes. Now, here's a good one. Let me take a look at this. This is a folding, and it's a good beginner cane. I said beginner.
That's the one I have.
Okay. I'm not recommending that one for you. Okay, this is called the beginner cane. Why did I call it the beginner? This is the beginner one where, when you try to get up out of a chair, sometimes it's a little difficult, or sometimes you have a little bit of unsteadiness, a little bit. Okay, a little bit. Now, if you have a whole lot of unsteady, okay, this is the beginner. Now, this is the advanced version.
Okay.
Listen, any knee problems, if your knees are weak, please don't use a beginner.
Okay.
You need stability,
Yes.
okay? The worst thing to happen, let me have that one
I
again.
have one of the regular ones. too.
Yeah, let me grab this and hold that. The worst thing to happen with the beginner, watch this,
Oh.
okay? You're trying to get up and it's sliding,
Yeah.
right? The other thing I want you to pay attention to these,
The rubber underneath.
once these rubbers start to wear out,
Change them.
please replace them. They will make you slide once they're worn out. This is really good. This one needs 2 replacements, okay? Because they are cruising for you to fall if they're smooth at the bottom. Thank you so
What
much.
do you think about those golf balls that people put on the?
Okay. Not on a walking cane. Walkers they help for them to move. I prefer, this is just me, a actual walker with brakes and the one with the seat. That will allow you to walk, and when you need to rest, you can sit down. Again, the ones that they look like a tent, and they put the balls on them. They're still making you do this. And anything that makes you curve over will in the long term affect your spine. Okay? So, hello. So on the story for durable medicals, I gave you an example of what we use in my office. Get your canes if you need it, get your walkers, get your glasses if you need it. Okay? Come on, if you're doing this, you need glasses. If you're doing this, you need to change your glasses and get some bifocals. Okay? If you're not driving at night because you can't see, you need glasses. Okay? If you get glasses and they don't work, that means the job is to let you see, take them back.
Exactly.
Okay? In fact, try them on when you get them so that you make the adjustments immediately. Okay? Say this is not working.
And the insurance allow you up to 6 months that you
Yes.
can do that, exchange, if it doesn't work, if you
But do
can't
it
see.
immediately. And here's one thing I want to tell you about glasses. Don't go fitting for glasses if your blood sugar or blood pressure is elevated.
That's true.
Because it will affect the vessels
The
in your
vision.
eye, which will affect your vision. So when you have a high blood sugar, you go get your eyes tested, you get one reading, and they order it, give you the glasses, all of a sudden, they don't work. Because now you've got your blood sugar under control. It's a different lens, it's a different view. So make sure you get your chest, blood pressure controlled and blood sugars controlled. All right? All right. Yes.
I have a
Just
question.
quick. Why does sugar affect your eyesight?
Because remember, diabetes, the bane of the universe, affects blood vessels. Diabetes affects your blood vessels. It affects their ability to dilate, they affect your ability to contract, they affect, they're always under construction. Think of the highway. All the blood vessels in your body, when you get diabetes, are constantly under construction because they're breaking down all the time. That's why you gotta get that blood sugar under control.
Whether it's low or high.
High or low, too low, too high. I want it just right, like Goldilocks. I want it right in the middle, between 80 and 100. Okay?
I have a question.
Yes, ma'am.
When you were talking about to raise the bed, what if somebody doesn't sleep on a pillow? Just the bed is spread and they just lay on that bed like that.
Flat? I mean, as long as you're comfortable. I mean, what you lay on has to do with your comfort level. Some people feel good on the flat, hard bed, you know? But if you're laying flat and you are snoring and you're stopped breathing sometimes, and people say, look, you may not know, but 4 times I was over you and you were breathing. It's time to elevate your head and get your breathing tested, because that can lead to a heart attack or a stroke if you don't get enough oxygen to your brain or your heart. Okay? And neuropathy, neuro, thinking nerve, and pathy, which is the way of the nerve. You have to think of how the nerves function. Nerves start up in the head and they extend down your spine and they spread out. They're the electrical system for your body. Think of your electrical system. If the electrical cord is not plugged in, there will be no power. Another example of that is if someone has a spinal cord injury in a car accident and that cord is severed. That is no power going to that nerve, and you will get complete weakness or maybe no movement. But over time, when you've been doing a lot of standing, you've maybe been in a couple accidents, you've lifted a couple of things inappropriately, the spine, which is the source of your nerves, these are your nerves coming out at different levels, gets compressed. They get compressed over time, especially if you do a lot of standing or sitting, where the pressure comes down on that nerve. You can get what we call little tingling pains. It's almost as if you stepped on the outlet. You know, you ever move your furniture and you put the furniture on top of the outlet and compress it, and you think something's not working? I do that all the time. So then I have to lift up the desk and then pull the cord out because for some reason it wasn't working. That's what you do when you have spinal cord compression. You're having issues with your chiropractor because the way of the chiropractor is the spine. You know, the way of the osteopath is the whole body. As a PCP, I look at the whole body as a unit. So one, it could be the spinal, it could be compression. But medications, some medications affects your nerves. Number one, like myself, chemotherapy. Over time, that affects your nerves. Medical conditions. There's some medical conditions that over time destroys your nerves, along with your circulatory system, your highway, diabetes. You remember, I tell you, diabetes is a poison. Your body is poison. And over time, when that poison hangs around, it starts affecting the nerves and the circulatory system. Those are the three most common: compression, medications, and medical conditions. So really, your chiropractor needs to work with your PCP. But once you have the conditions, what you can do: number one, improve your circulation. Stop sitting all the time. Stop standing all the time. Movement, stretching, get the spinal cord aligned. Okay? Have your medications evaluated. Are these medications? Control your blood sugar and your blood pressure. Control those things. When you get those things controlled, your body changes. It starts changing. I know I'm talking to the choir because you guys are here and you've been exercising, you've been doing all the right thing. But if you have friends, avoid having closed shoes that compress your feet. That's why they say diabetics have to wear special shoes, because compression can affect your circulation and also lead to more neuropathy. Okay? But that's a whole nother class. I'm going to do it another time.
The burning of the fingertips.
Burning is just another form of a nerve. Burning, tingling, numbness are all signs of your nerve's activity. Okay? That's how we know if we burn ourselves. Oops, it's hot. We don't feel it. Ooh, I can't feel it. You ever sit for too long and then all of a sudden like, wake up, wake up. All those are the nerves in action. They're there to tell us what's going on in the body. Our nerves alert us.
Nighttime, late at night.
Usually you're laying down and you're compressing the spinal cord. Or you're sitting in front of the couch for too long. That happens to me all the time. I start getting the recliner and then you're compressing your lumbar spine. And you get up and you're like, wake up. My sciatic nerve acts up when I sit too long in my recliner. But I want to go into something, and I'm glad we were talking about this today. If you're 65 and it just started bothering you, it's not time for surgery. Yes.
What about the vascular? They say if I'm just told like there might be a vascular problem.
Okay.
The veins or whatever.
Veins. The difference between a orthopedic problem or arthritic problem, remember, always think of joints. When you start thinking vascular, you're thinking about the circulation to an area, because that's the highway to those joints. So you're looking at the major veins, major arteries, and major nerves. If you have back problems, you often will have knee problems, because what we do is we favor. You start tilting to one side to avoid the pain in that area, which will lead to compression of the nerves and the arteries in that area, and it'll shoot down the leg. But back to your question. There's a thing called claudication. You're walking and you start feeling pain in that leg. Not in the joint, but in the actual leg. Okay? Look out for a circulation issue. You start getting a lot of cramps in that leg. Look out for your potassium and magnesium intake. Okay? Magnesium's over the counter. First thing I do is start taking magnesium if you start getting cramps. Number 2, actually. Number 1, hydrate. Make sure you're hydrated. One of the number one reasons people get cramps is because they're dehydrated. Number 2 is your magnesium levels low. And if you're on a blood thinner, a diuretic, a water pill, you're releasing a lot of potassium in your urine, and that could lead with cramps. So pay attention to the medications that you're taking. Okay? I hope that helped a little bit to talk about the
And you didn't
joints.
say number 3.
Oh, number 3, of course, back to leg problem. Shoes. Your shoes.
That's what I was about to say.
Your shoes.
High
What's
shoes,
on your
high
feet?
heels.
What's on your
Yes.
feet? Not just heels. Some people actually, when they get a
High
condition
shoes,
called
yes.
plantar fasciitis, they need to go up because they have an arch and then they lose their arch, and it drops the arch. wearing a shoe for 10, 20 years. There is no cushion, there's no surface on there, but it's my favorite shoes. I like it. It's so comfy.
Hold on to
it.
it.
Holding on to a dead and dying shoe. It's like driving your car when the tires are bald.
Yes.
You're not supporting your car, which is your frame. When the shoes go down, usually they say about 6 months for tennies if you're active. 6 months, you need to replace. Look at the bottom. If it's smooth, everybody should look at the bottom of their shoes. If it's smooth, you worn it out, time to replace. There's a reason they put grips on the bottom, right? There's a reason for the grips. And that, yes,
What is the issue with neuropathy?
oh,
That
yeah.
is so.
Eucalyptus oil, I think Walmart sells it, and you rub that baby on, it also is very helpful for pain. Simple thing like Vicks, two purpose, help my cough and help my joints.
Oldie but goodie.
Oldie but goldie. And nothing helps like soaking. A nice warm soak in some Epsom salt. You know? The heat, again, helps to reduce inflammation. And the key is, of course, you don't want a nice to soak, relax yourself, and then jump up and start running around the house, vacuuming and cleaning. No, you want to do your relaxation and sit down and relax that joint. Another wonderful thing that also helps with joints that may be injured, compression. Compression.
Yes.
So compression, that's where if you have a backache or a back problem, it's not a bad idea to get a back brace. Now here's the key with the back braces. They have to fit. You can't have a back brace that moves up and down on your back. Come on, tell the truth. You know you've gotten those braces and you bend over and it moves up, you stand up, it slides down, rotates around. It's true, right? You want to make sure your back brace actually fits. And more importantly, it's supporting the area that has the problem. If it's lower back, don't put it all the way up that it's sitting in the middle of your back. You need it lower down here. Exactly. And some of them, really cool ones, I found one, and I can talk about it because I almost sleep with a heating pad every night. They have a heating element that you can put in the brace and wear around. I have one that has a little control on it where it's a brace and it also puts a little heat to that area. Nice one. Knee braces. Be careful with knee braces. A lot of people have knee problems. Be careful with the knee braces. You know, you start walking, they slide down your leg, right? Next thing you know, after 3 hours, they're at your ankles, and they're not doing anything for you. Some of them compress your knees so much that your top of your leg gets swollen and the bottom of your leg gets swollen,
Blood does that.
right? Don't do that.
The blood not circulating.
It's not circulating, it's getting cut off because the brace is so tight. You know, I personally, the least expensive type of knee brace is a nice large ace bandage. Believe it or not. Get yourself a nice large ace bandage that's long and you wrap from your ankle up to your mid-thigh
Wow.
with an emphasis around the knee area. So you wrap, and then wrap the knee and then keep it going to the top of your thigh. And you'll avoid having the swelling at the top and the swelling at the bottom. That's a nice cheap way. Nicely inexpensive. Now, if you want to choose, say you're active, you know, you like walking every day, going to the gym, then you get one with good support. And many of them have, especially if you have a ligament tear on the lateral aspect of your knee, there's some that supports. They have the support on the sides and the opening in the middle. But those braces you're only going to wear if you're going to be active. Very short, 2 to 4 hours. You don't want to keep them on all day. You know, for average, walking around all day, put on your ace bandage. Okay? But to be active, go to grocery, supermarket, get one with the opening at the knees so you can flex, but good support on the sides so that you're stabilizing. Because what's causing the pain is instability, right? The kneecap going up and down and your knee sliding side to side, right? And there's no cushion. There's no cushion in the knee. Knees, Okay, so right in here is supposed to be a cushion. And over time, it's like brake pads. It wears out. And I know a lot of people are afraid of replacing the brake pads on their knee. You know, I don't want no knee surgery. I heard such and such had their knee surgery. And